Everyone, we're going to go ahead and do a needs analysis and training program for professional ice hockey. It's myself, Jamie, and Kerrie, Kiaa, and Kionte. So when constructing a training program, what we wanted to highlight is we wanted to make sure that we consider the game demands as well as the technical skills that come along with it. So we have to think about the high intensity intermittent of the natural play. We have to think about quick bouts of energy, high intensity skating, and that's when the energy systems come into play as far as for the anaerobic and aerobic capacities. Then on top of that, we have to think of the technical skills. Once they're in more of a sports specific period of their training program, we have to think about the passing movements behind that, puck control, shooting. And this again is where we focus on increasing muscle mass in order to deal with the checking that involves angling of the body and positioning and defensive tactics. So I'm going to go ahead and turn it over to Kiaa, who's going to go ahead and talk about our energy systems.
Thank you, Jamie. When incorporating a strength and conditioning training program, it's important to analyze physiological and physical demands of the sports players. When looking at the energy systems, our ice hockey players predominantly use anaerobic glycolytic system and aerobic oxidative system. For the anaerobic, they're using about 69% of this during their games and their plays. This will include peak power times, rapid acceleration, quick changes in direction and velocity, high intensity skating, high impact body contact. When looking at their aerobic movements, this can be seen when they're doing rest and recovery in between high intensity work or plays, sustaining performance during play. So they are playing at a low, they're using their low intensity aspect of the aerobic oxidative system. Minimizes fatigue, increases aerobic fitness, and these influences their performance metrics such as VO2 max, lactate threshold, and their heart rate. So I'm going to pass things over to Kerrie. She's going to go over the biomechanical aspects.
Perfect. I'm going to go over the biomechanics and some injury prevalence that's more prone to pro hockey athletes. So some biomechanical considerations to consider. The skating involves a pushing leg and a stance leg. For the pushing leg, it's going to involve some hip extension, a little bit of a hip abduction and external rotation, along with knee extension and ankle plantar flexion, so that triple extension moment. And then that force is going to transfer into the stance leg. That's maintaining some hip flexion, slight adduction, internal rotation, knee flexion, and ankle dorsiflexion. Because of these range of motions and how of like the high velocity intensity they're moving at, it's going to really push the limits of hip and ankle range of motion in all planes of movement. This can cause hockey players to be more prone to more hip pathologies and especially femoral acetabular impingement, or FAI. This is common, especially amongst goalies, because of the butterfly technique they utilize when protecting the lower portion of the goal. That's going to involve a lot of excessive femoral internal rotation, knee valgus, and a little bit of excessive coxivara in that hip joint. This is going to cause a lot of great torsion in the Q angle at the hip joint. And then that can cause the impingement from the overuse in the femoral head continually rubbing against the acetabulum in not the right way. And some pictures to show how they're skating and the biomechanical aspects behind it. And then this is our San Diego Gulls hockey goalie. You can see the butterfly technique being utilized, and then you can even see in their defensive positioning that they do have a lot of excessive knee valgus and a little bit of all that movement into that butterfly effect. And then now I'm going to pass it off to Kionte. He's going to talk about sports testing and fitness testing.
Thank you, Kerrie. And so as we talk about sport testing and fitness testing, these were selected based on research. And so for the counter movement jump test, hockey athletes are going to be predominantly going to use their lower body most when on ice. And so for the hockey players, it's good to have them. They're going to need explosive power in their legs for quick strides, especially like during like acceleration and change of direction. And then so counter movement jump is selected as it's a good assessment for explosive movement in athletes that can and this can also be transferred from off ice to on ice performance. And then as we go into isometric mid thigh pull test, it measures maximum strength, and as well as assists with strength and explosiveness, especially like rated force development. In this case, how quickly a hockey player can generate force in a short amount of time, which is important when for on ice agility as well as change direction. For squat jumps, it assesses their vertical power and generates from a lower body explosiveness and concentric force production. And this can also be translated to on ice acceleration, quickness, as well as agility starts on ice. And then as we move into Wingate, because this is a anaerobic sport, the Wingate test requires the ability, or hockey players to require the ability to sustain high intensity efforts followed by brief periods of recovery. The Wingate test assesses the capacity of anaerobic performance, which simulates the intensity efforts in a hockey match. And then when it comes to the 30-meter skate sprint assessment, kind of straightforward. It assesses their linear speed and acceleration over a short distance, which mimics in-game hockey performance, whether getting to the puck or recovery on defense. And all these tests allows us as strength coach or those as strength coach to gather information that can be used to tailor programs and adjust performance developments throughout the off season as well as on in-season training periods. So I'm going to pass it off to Jamie as we move into the strength.
Great. Again, so kind of tying everything in as we move into the training program, just the physical demand to kind of think about as we go through it is the speed, the quickness techniques, the strength and the power, explosive movements, and the usage of the energy systems to sustain performance and then change in speed and direction. So I'll have Kerrie, if you can take us to the training program, and we'll kind of just like go briefly what our thought process was as far as for beginning the program. So as you can see towards the top, we kind of simulated what a professional ice hockey season would look like. So then now we're taking into consideration the time prior to that, so the off-season section. So then as you can see here, to kind of begin, this is where we're working on our anatomical adaptation moments here. So again, we're now preparing ourselves for the season. We want to make sure we have a strong foundation. This is when we would incorporate baseline measurements to kind of see where our players are. And then again, anatomical adaptation. So any kind of fostering the training program to kind of accommodate to their present state to where we want to get them in order to start working like on hypertrophy to build the muscle mass in order to decrease possibility of injuries that Kerrie kind of mentioned as well. So that's more kind of like within the preseason section. Now, as we move more towards in-season, but still within the preseason section, we're kind of looking now at more specific preparation. So this is where we're going to start incorporating more sports-specific movements, getting closer to like the natural play. So what we're going to incorporate here now being that it does involve like high intensity movements, quick bursts of energy. We're now implementing plyometrics into this section of the training program as we prepare for in-season. So then you can see like the red blocks on the plan that kind of just gives you an idea of where we would test and what tests we would do. And then below the actual strength section of the program, we have conditioning, and this is kind of what Kionte went over as far as for the on ice and offsite on ice training sessions and what they would look like and what they would incorporate. So that's kind of give you a general idea of how we started a program. So again, this is a needs analysis and training program for professional ice hockey.